The incidence of hearing loss has increased 30% in the last 10 years. 48 million Americans, in fact, age 12 and older, have experienced hearing loss. And Dr. Jill Caseworm is here to talk about hearing loss and what can be done about it. Welcome to the show, Jill.
Thank you very much.
Well, let's talk about it. This is a startling statistic to me. The incidence has really increased a lot in the last 10 years. Why is this? Are things noisier than they used to be?
Absolutely, and it is startling.
Yeah.
It's really epidemic in proportion.
Yeah.
And part of the reason for that, of course, is people are living longer.
Okay.
And the longer you live, the more likely that you'll have a hearing loss.
Mm-hmm.
But the other reason is people are acquiring hearing losses at younger ages.
I'm going to take a guess, and I've not talked to you, I've not done the research, but these earbuds that are all these kids, you kids today are wearing these earbuds, that can't be good, can it?
Well, you know, it's such a concentration of energy, Gordy, that goes in the ear.
Yeah.
And none of it gets lost. It all goes in, and it does cause damage over time.
Is that part of it?
That's part of it. And you know, the other thing is, for whatever reason, our society has come to believe that louder is better, and louder causes more hearing loss. You know, in my workout class this morning, I always bring my earplugs, but I still contend to them, why does it have to be loud enough that I have to wear earplugs in my workout class?
Right.
You go to a restaurant today, they're noisy because the owners want it to feel lively, and lively is equivalent with noisy. So.
Well, sure. I have another theory. Let me just run my personal theories by you. People my age, you know, I'm getting up there, went to a lot of rock concerts in our young years, and now here we go. All these years later, suddenly I notice a lot of my friends have hearing problems. We all went to the same shows. They were loud back then. They're loud nowadays, too. But I notice more people nowadays do wear earplugs sometimes at rock shows or loud places. So is that part of it? I mean, some of us in the baby boomer generation, we're getting to that age where we're losing our hearing.
The oldest baby boomers this year are turning 69.
Right.
And that's the first time when a person generally starts really noticing their hearing loss and starts getting hearing aids. So it's just that life's caught up with those baby boomers, with all of us. It's not just the rock concerts, it's everything, you know, the power tools, the noisy restaurants, and just life in general.
Right. But here's a startling statistic, and you supplied some of this information here, but now there's a strong link between the degree of hearing loss and the risk of developing dementia. Talk about that.
Absolutely. Just think about it. You can't process what you can't hear.
Right.
So what happens with hearing loss is it starts very gradually, the high frequencies first. So it's not like you lose the ability to hear. You still know there's sound, but you don't hear clearly.
Yeah.
So now you're sending these distorted messages to your brain, and yes, there have been a lot of links between a higher incidence of dementia and hearing loss.
Now, I mentioned to you before we started here, I have a grandson who is deaf because of bacterial meningitis, and it caused his deafness. He has cochlear implants now, and he's beginning to be able to know how to use those, and it's starting to make a little bit of sense now. But for young kids and younger generation, what's the best way to prevent hearing loss? Testing, I imagine? I mean, they test them in school, right?
Well, most kids today are tested, you know, most babies are tested when they're born. And what's so great, because then the loss is identified so young and they can do something about it right away, so it doesn't affect education as much. But young kids usually are identified right away.
Okay.
But it's the adults where it's missed for so long, and usually by the time a person notices it for the first time, it's been 6 or 8 years that they've had a problem.
So what's your recommendation for folks?
If you're 50 years old, have a hearing test.
Really?
Have what we call a baseline against which all other tests are compared. If you ask people to repeat, if things seem a little muddy and not as clear as they used to be, or if you're always saying what or huh, absolutely see an audiologist and have a hearing test.
And if people want to find out more or contact you, Jill, how do they do that?
You can either go to our website, www.prohear.net, or my personal website is drjillgyl.com.
Very good. Jill, pleasure to meet you. Thank you for coming in.
Thank you very much, Gordy.
Appreciate it.
It's been great.
Yeah, good to see you. Next up, we'll find out about the upcoming performance of Vesper Chorale. We'll be right back.